I'm Margaret Kruk, and I am an Associate Professor of Global Health at the Harvard School of Public Health. I am also the Chair of the Lancet Global Health Commission on High Quality Health Systems, which had important input from Nepal and the Nepal Quality Commission, as well as the input of Mr. Gagan Thapa, who was one of our valued commissioners. Yeah, a high-quality health system is a health system that works for people. It's a system that consistently provides good services that improve or maintain health. It's also a system that creates trust and confidence in the population. And lastly, it's a system that can change and adapt as the population's needs change. We have made tremendous progress in many countries, including in Nepal, in encouraging women to come to facilities to deliver. And yet what we're seeing is in the last decade or so that despite rising delivery numbers, we are not able to reduce maternal and newborn mortality as quickly as we had hoped. And what this points to is that the quality of care is simply not there for mothers and newborns. We think of maternal and newborn mortality as well as stillbirths as symptoms of low quality health systems. I think if we want to improve the survival of mothers and newborns, we have to take a system-wide approach and not a provider-centric approach or a single clinic at a time approach. And so what I mean by that is we should think about how our entire system is configured and prepared to save a life. Is the woman delivering in the right level clinic so that if she develops a complication, it can be immediately attended to, not in 4 hours, but within 20 minutes or 15 minutes. That's what's required to save her life and that of her newborn. We also need to know whether the providers looking after her have the necessary training, experience, and backup supports to be able to respond quickly and effectively when a major bleed occurs or a seizure or the newborn is gasping for air. So it's really about a systems approach, and no single checklist, no single app or a poster is going to solve this problem. I think research is a fundamental input to high-quality health systems for several reasons. First, without research, we cannot even describe the situation. It's difficult to know how bad quality is if we don't do some research and discover and measure quality. So I think that's the first step. Second, research is also required to test new approaches, new models of improvement. Is it going to be better, for example, to deliver women in midwifery-led teams versus other kinds of teams? Are they safe to deliver in large health centers near a hospital, or is it safer to deliver inside the hospital? All those are questions that can be and must be answered by research. Otherwise, we are just continuing to invest without knowing if there will be a return, and most importantly, a return in lives saved. Yeah, so I think Nepal is a challenging country because you have a very challenging geography, of course, particularly in your remote and mountainous regions. It is not easy for women to travel to health facilities. And I think it is also a health system that is undergoing a big change right now. Your whole country is undergoing a large change, and decentralization and federalism have created, I think, some confusion about who's responsible for what and how do we deliver services. But I think at the same time, this new approach in your health system, which decentralizes decision-making to the lowest level, is really an opportunity to try for improvement, try big, bold new ideas, because that local authority wants to satisfy the population. They want to see improvement. And I think they will have more courage in some ways to try something big. The key point is we have to evaluate it to know if it worked. Thank you. It's a pleasure to be here.